Welcome to Impact Signals, Social Impact at the Scale of AI. I'm Charlie.
And I'm Sarah.
It's Monday, June 15, 2026, episode 63. Today, AI is mobilizing inside the first global health emergency declaration of the AI era, the 2026 Ebola outbreak in the Democratic Republic of Congo and Uganda, with contact tracing tools and clinical evidence platforms live in the field. Meta is giving free AI glasses to 130,000 blind U.S. veterans, paired with structured training from the Blinded Veterans Association. And a new global early warning system published in Nature Climate Change gives conservation teams 9 months of lead time before extreme heat hits vulnerable species ranges. We start in the Democratic Republic of Congo, DRC, where the World Health Organization, WHO, declared the 2026 Ebola outbreak a public health emergency of international concern on June 12. The outbreak is caused by the Bundibugyo virus and has spread across DRC and Uganda. It is the first major Ebola outbreak since AI tools went operational at scale.
What makes this significant is that AI is not waiting for the outbreak to stabilize before entering the response. Richard Hatchett, CEO of CEPI, the Coalition for Epidemic Preparedness Innovations, told Semafor that AI tools are already mapping where cases are occurring against conflict zone geographies in near real time. In active outbreak areas, that means a contact tracer knows which clusters sit in contested ground before leaving base.
On the same day WHO issued the declaration, Elsevier launched a free Ebola information center combining clinical guidance, peer-reviewed research, and its AI-assisted research workspace, LeapSpace. LeapSpace lets health workers rapidly map existing evidence on Bundibugyo virus pathology, surface treatment approaches, and analyze their own data alongside published literature, at no cost for the duration of the outbreak.
The model is the easy part. The hard part is access. Rapid evidence synthesis during an outbreak used to require institutional subscriptions and research infrastructure that most field organizations simply did not have. Elsevier making LeapSpace free changes the access equation. A team in Eastern DRC now has the same evidence discovery capability as a well-funded institution in Geneva.
Semafor and Elsevier both published on June 12, the same day WHO issued the declaration. MSF, Médecins Sans Frontières, is actively scaling its response. This is the first documented instance of AI tools for field epidemiological risk mapping and AI for clinical evidence discovery activating simultaneously at the declaration stage of an Ebola outbreak.
For NGOs operating in conflict-adjacent outbreak zones, the practical takeaway is to layer AI conflict risk geography into contact tracer routing before field deployment, not after. For clinical teams, the Elsevier Center is free and accessible today. Smaller organizations have no reason to wait. The access gap is closed.
Moving to the United States, where Meta announced a nationwide program to give free Ray-Ban AI glasses to all 130,000 legally blind military veterans in the country, the largest single assistive AI hardware deployment on record.
What makes this significant is not the hardware scale. It is the training infrastructure paired with it. Assistive technology programs routinely fail at adoption, not at access. Meta built structured onboarding through the Blinded Veterans Association, BVA, into the program from the start. Hardware without training is abandonment at scale.
The glasses identify objects, read printed text aloud, assist with navigation, and respond to voice commands. BVA is handling structured training for all recipients. Meta is funding both the hardware and the training program. Eligible veterans can register at BVA's website. This is the largest assistive AI onboarding effort ever attempted.
For practitioners serving visually impaired populations globally, including in low-income settings, the hardware cost is not the replicable part. The BVA onboarding framework is. Study how that training was designed for a population with varied technology familiarity, then adapt it to lower-cost devices and local community health workers. That is the design principle worth copying.
Story 3. An international research team led by scientist Joseph Saradias published in Nature Climate Change the first global early warning system for biodiversity heat risk. The system forecasts when and where vertebrate species will face unprecedented heat exposure, up to 9 months in advance.
What makes this operationally significant is the lead time. In historical validation testing, the system produced accurate warnings 3 to 5 months before peak heat exposure across more than 30,000 species of mammals, birds, reptiles, and amphibians. 3 months is enough time to deploy water provisioning, emergency translocations, and intensified monitoring. Reactive response after the heat event is not.
The validation period identified more than 3,500 species projected to face unprecedented heat, including over 1,250 species of conservation concern. Mexico, Sub-Saharan Africa, and the Himalayas were the highest-risk regions. The system runs on NASA existing sub-seasonal to seasonal climate forecasting platform. No new sensors required, no new infrastructure to build.
Conservation organizations in Sub-Saharan Africa and the Himalayas should start tracking this system's outputs now and mapping them against their active program areas. The warning only matters if the deployment plan is waiting. Build the response protocol before the warning fires.
Pivoting to India, where 2 AI hazard detection systems went operational this week. ISRO, India's space research organization, and Andhra University launched Project Bharati along Andhra Pradesh's coastline. AI cameras, thermal imaging, and satellite data detecting rip currents in real time and triggering warnings to lifeguards and beachgoers. Total implementation cost, roughly $26,000 US, and Konkan Railway Corporation, working with CDAC, the Center for Development of Advanced Computing, deployed an AI rail track monitoring system across 756 kilometers of western Ghats mountain terrain to catch landslides and boulder falls before they cause accidents.
2 hazards, 1 architecture. Real-time sensors, machine learning inference, direct alert to the person in the field. Rip currents kill more beachgoers globally than sharks, and coastal communities across the global south operate with minimal lifeguard coverage. Mountain railways in Nepal, Ethiopia, and Colombia face the same seasonal landslide risk the Konkan corridor manages every monsoon. For local governments and NGOs managing coastal or mountain infrastructure, both systems are deployable frameworks at government program budgets, not research grants.
On the disaster watch, the Philippines is managing the ongoing Mindanao earthquake sequence. A magnitude 7.8 struck offshore Sarangani province on June 8, at least 65 killed, more than 1,400 injured. General Santos City, population 722,000, sustained significant damage. A magnitude 6.2 aftershock struck today with 6.3 million people feeling the shaking. PHEIC, the Philippines Earthquake and Volcano Monitoring Agency, is tracking the aftershock sequence. Cuba also recorded a magnitude 6.1 in Pinar del Rio province on June 8, felt across Havana, no major casualties per USCs.
The Mindanao sequence is directly relevant to today's Ebola story at the operational level. In both situations, the field challenge is coordination under active disruption. In Mindanao, aftershock sequences and damaged infrastructure block responder access. In an Ebola conflict zone, armed groups and rotating staff do the same. Build for disruption, not the stable baseline.
On the calendar, MSF opened an Ebola simulation training center in Nairobi, Kenya today, running intensive 2-day clinical workshops through August 2026. Topics: PPE, personal protective equipment, protocols, infection prevention, and emergency coordination. Priority registration goes to experienced medical staff preparing for DRC deployment, followed by Kenya Ministry of Health and partner organizations. The G7 summit also meets in Avion-les-Bains, France this month, with AI access for the Global South and debt relief explicitly on the agenda.
The MSF Nairobi Center is the most directly actionable calendar item for this audience. If your organization is planning Ebola response deployment, contact MSF now. Experienced medical staff have priority, and those slots fill. On the G7, AI access framing for the Global South at heads of state level is unusual. Track the communique language, not just the announcements.
Funding Watch, FAO, the Food and Agriculture Organization, has direct grants open for local organizations in DRC, Kenya, Togo, and Tanzania working on community-led forest and landscape restoration, ranging from $5,000 to $50,000. Deadline, June 19th, 4 days from today. The UNHCR, the UN Refugee Agency, Innovation Accelerator is open for proven innovations ready to scale for refugee and forcibly displaced populations worldwide, up to $250,000. Deadline, July 12th. And Anthropic's Claude Core Fellowship places 1,000 AI fellows at U.S. nonprofits for 12 months at $85,000 salary. Applications close July 17th at anthropic.com.
The FAO grant is the one to act on today. 4 days is tight, and the eligibility is specific. Local organizations in those 4 countries with community-led governance structures, not just community-based project sites. That distinction trips most applicants on the form. The UNHCR Accelerator requires documented field testing before you apply, and the review panel grades hardest on maintenance and sustainability after pilot funding ends.
The through line today: AI mobilized inside an active WHO-declared emergency for the first time, mapping conflict risk for contact tracers in DRC, opening free evidence tools to every field organization, while the same real-time detection and alert architecture repeats across coastlines in Andhra Pradesh and mountain rail corridors in the Western Ghats. The pattern is showing up on 3 continents this week.
The replicable lesson is the architecture. Sensors, inference, direct alert to the field. Treat governance as a design constraint inside that pipeline, not a layer you add afterward. Whether you are routing contact tracers around conflict zones, alerting lifeguards to rip currents, or stopping a train before a boulder hits the track, the governance question is the same. Who has authority to act when the alert fires, and what is the escalation path when that person is unavailable? Build that in. That is the governance line.
That's Impact Signals for Monday, June 15, 2026. If this briefing is useful, subscribe wherever you get your podcasts. Check us out at impactsignals.ai and share it with someone working in the field.
Stay ready.